We all love the sound of money, and a $1,500 sign-on bonus sounds even better. That's right, Belicio Foods of Jackson is offering a $1,500 sign-on bonus to new employees. Receive an extra $100 your first 6 weeks, then $400 after day 90, and $500 after day 180. Don't wait. Apply online at beliciofoods.com/careers today. That's beliciofoods.com/careers. Come work for a company who truly values their employees. Come work for Belicio Foods.
Well, good morning, everyone, and welcome to another edition of the morning show right here on Main Street TV. We're so happy to have you with us this morning. Of course, Jennifer here to start off your morning with a good friend from one of our favorite places, and that is Holzer. And we have Breanna Morgan with us this morning, and Breanna is a nurse practitioner at Holzer. So welcome.
Hi.
We're so happy to have you here. And we were talking off the air. You have a really cool, interesting fact about yourself. But first off, would you tell everyone a little bit about yourself, where you're from, your background, that kind of thing?
Sure. So I am born and raised in Wellston.
Okay.
Clear back as far as you can go. I am from Wellston. So I've always lived here and been strong in the community. I graduated from Wellston High School in 2010. I knew very early on that something to do with taking care of people was something I wanted to go into. I always loved doing that. Found myself nurturing when people got hurt on the playground, or I was always finding something that needed fixed. So that kind of led to me knowing I wanted to go into healthcare straight from high school. I went for my LPN. From my LPN, I decided, this isn't enough. I'm not filled yet. So I went for my RN. Finished my RN, started my nurse practitioner, actually had to stop and never thought I would complete the goal. And then I told myself, we're not fulfilled. So we're going to finish this. So I decided to go back and finished in November of 2021 with my family nurse practitioner. And then I had to complete my certification boards, things that all got finished in February. And then landed a community job, which I had no idea I would be this close to home. I thought I'd be traveling.
That's amazing.
So then I ended up with Holzer, and hopefully I am there for a very, very, very long time. So
very good. So you're happy there, and we love having a local person in the community.
Very happy. For a mother who needs to get coffee in the morning and be close to work, I'm 10 minutes from my house. So I can definitely, the minivan can go on 2 wheels. We're on time. The coffee's had, and we're good to go.
We're good to go.
Yes.
And why is that a little stressful for you in the mornings? Because we were talking about this off the air. Now, this is really cool.
So there's multi-stress involved. I'm not only the lover of children, but I also rescue and have an obscene amount of animals. So that's always a chaotic part of my zoo. But I'm also a mom to triplets that will be 5 in October. So every day is a rat race. Every day is a rat race. Every day.
How do you do it?
Coffee, prayer. Basically, I have done it for so long. My husband has always been in the union hall, so he's a laborer. For years, he worked away when we first had them, and then he's finally closer, but he still starts much earlier. So I have done it since they were babies. So I've had no choice. They've just kind of been mine, and we've just kind of been the team. That's what we call each other, the team. So I kind of just got used to always busy, fast, chaotic, mornings, nights, you name it. So we just kind of do our thing, and somehow we make it from point A to point B, and we get there.
I'm just sitting here thinking this girl's doing her nurse practitioner and all that during all of that.
I did, and I took 0 time from them. I went a very long time wanting to be a mom, many years. Second fun fact, my husband is my high school sweetheart. So many, many years we wanted a family. When I finally got them and got the exciting news that there was 3.
Is that what it was? Exciting?
Very nerve-wracking when your husband's not around kids very often. We go to an ultrasound appointment before he started working. Like I said, he's a laborer. So took off and paid for an ultrasound in Columbus early because I couldn't get in to get one year I wasn't far enough along, and that little girl's like, oh, I need to look around a little bit more. And I'm thinking, oh no, because it had took some time. She goes, oh, I'm right. And I was like, oh, just
You're
spit it
right about
out.
what?
Like what? And she's like, there's 3 heartbeats. And my husband's collar went from, I mean, it was.
Like, I'm getting stressed out listening to your story.
So nobody believed us. We called family from Columbus and told them, and my parents were like, "You're lying." And I'm like, "No, like I'm not.
That's not possible.
You have to stop by the house." So we had to stop by with ultrasound pictures with 3 ABC wrote on it, and from there it's just been wild. But I made, I had told myself we worked so hard to have them that I wouldn't take time from them. I didn't want to get a babysitter for clinicals. I didn't want to do those things. So beyond my work schedule with my clinicals, which I had to kind of work part-time, full-time, per diem style to get through, I did everything at bedtime. And so they would go to bed. Let me backtrack that. They would go to bed, but they're 5
wanted
and still
them
don't
to
sleep.
go to bed.
So they're almost 5 and still don't sleep all night. But they would go to bed, and then immediately when they would go to bed, it would be, I just knew. And I knew that, like, if I wanted this dream for me and them and I wanted to be fulfilled and have a career, that I knew I had to do it. So that's what I did for 2.5 years. I did everything at bedtime.
Now, who does not want this girl to take care of you? Because she is so dedicated.
Come see me. I've rescued animals. I have lots of kids. Like, come see me. Come on.
Nothing else, be your therapist. It's fine.
Yes, come on.
No, I have to think. I mean, we could do an entire show on, questions about having triplets, because I feel like that is just like mind blowing. Because I feel like one goes to sleep, the other one wakes the other one up, and then there's just a vicious cycle of.
We used to on the weekends. Well. My husband would give me a break, because at first he worked out of town. Thank gosh, that didn't last very long. He still worked long nights, but he got to come home every night. We would do our weekends. It was such a chaos because they all 3 slept in the same room for a long time that we'd rock, paper, scissors whose turn it was to go in the room because one would wake up. So it was like this rock, paper, scissors. Okay, it's your turn. And I'm telling you, I lost every single time.
He had a system.
I was never, ever, ever good at rock, paper, scissors. Still not to this day. But we just went through the chaos. And I am a type of person that you have to find beauty out of your life. Like, I don't care what's going on. I don't care what diagnosis you just got. I don't care how hard your life is. There's something beautiful. And tomorrow is going to be so much better than today. So when we have a bad day, which are few and far between, now that they're older because they're more independent, I mean, we do have those moments where they think they can pour their own cereal bowl and the whole gallon of milk hits the floor. We just take it. We take it and roll with it. So if we have a bad day or a bad hour, we make the next hour better. We go get ice cream. We go do something. The next day we focus on the positive. So that's just how we kind of live.
This is so amazing. You should be a life coach on top of all this.
Side note, I have lots of cool things about me. I just don't always talk about them. So I ran a Facebook page, and I also have TikTok, which social media can be a very bad thing or it can be a very good thing.
Yes.
I use it as a very positive platform. I always have. So I started it in the midst of starting my nurse practitioner. I was also in the midst of fighting postpartum depression.
Yes.
That I did not know I had.
Yes.
I sat at home and I had no, I didn't know how real of a thing it was. Yes. So Dr. Moorhead was my OBGYN at the time. Perfect. Amazing man. Just an amazing man. I can't say enough good things about him. So I seen him, and at the time I said, there's got to be more to this. There's got to be more to why I'm feeling this way. I then said, I'm going to start a journey for other people. So I did. I delivered my babies at 360 pounds. I went into preeclampsia. I was very large. I was then 339 pounds when I told myself, like, you are not doing this anymore. You're going to be there for someone. And I'm currently down 116 pounds and counting. So this has all been kind of like an ongoing thing. But in the midst of that, I really found that my love for helping people was thriving. Like, I was going through school. I loved helping people. And I have people all over the country that will find my page or message me. And cool thing about it, I just kind of did it for accountability and to be there for others when I was actually at my lowest point for myself.
Right.
Strange to do that, but it worked.
It's a good philosophy, I think.
It really worked. So my cousin is actually a social worker in San Francisco.
Okay.
So he's clear out in California. And he calls me and he's like, of course, we always talk healthcare. We're not breaking HIPAA laws and things like that. And we didn't go into any details, but he said, I just want to let you know that I spoke with someone today that said, this girl on Facebook has really helped me. Like, I don't know how she does it. She has triplets and somehow she is so positive all the time. And it was me. So he was in San Francisco.
Small world.
So it was really, really cool. And I thought,
Yes.
you know what? So I have continued to do it. Of course, there's times that it slows down. When I started my job, I wanted to full force go that route and focus on my career and get really established and going. But I love it. I have always loved helping others, and I've just kind of continued to do it. And something about my kids has just really pushed me to do all of the things because I want them to look at mom and be like, my mom did it,
Yeah.
So,
be an example for them.
And also, too, did I tell you I'm really emotional? So sometimes I talk about my kids getting emotional. I promise I'm not going to get emotional today. But
That's great.
I just want them to know, and I have really, pushed for that. No dream is too big. I don't care where you are. I don't care if you're 60 years old and you want to go back to be a nurse.
Yeah.
If you want to go back to be a nurse, you go back to be a nurse. Nothing's too big. So
love that.
That's kind of them are my side hustles beyond being a mama and rescuing animals and things like that. Those are kind of that's kind of my fun. I just kind of keep others happy. That's what I like to do.
Love that.
Thank you.
So I feel like you're exactly in the perfect profession for that.
Yes, that is kind of why I chose my career. I wanted to have. When you're a nurse, you're kind of a middleman. You have someone ahead of you establishing that relationship. Then you have, as a bedside nurse, I had the orders that had to been given. And then, of course, I established my own relationship with my patients. But I have full control of what happens.
Mm-hmm.
I have full control of how I manage them, how I talk to them, how I educate them. I don't have to have this person starting the conversation of this is your diagnosis. This is what you need to do, There's ways you can communicate with people that you're not shoving it down your throat.
Mm-hmm.
Just like an example, if you're dealing with someone who is overweight and you're clearly seeing that, their food essentially is what's hurting them. There's ways to go about it that not make them feel like they're crap for what they choose to eat or that they can't afford, so there's, and I wanted that control. I wanted that control. I wanted to be able to talk to my patients. I wanted to be the provider that lays on the floor with people with autism and people with Down syndrome who just, that's how they communicate. They don't know. That is their special ability and way to communicate with you. So that was kind of my driving force. I wanted to have my control of my caseload, of my people, of my patients. I wanted to be their person. So that's kind of how it did that for me.
Well, good for you in the midst of all of the triplet madness. All right. So let's talk for a minute within explain for the folks out there that may not understand the difference between nurse practitioner and medical doctor or a family, I guess what the word doctor would be.
So at a nurse practitioner level, we are considered mid-level providers. So we do, the MDs and DOs have more education than us, essentially. They go into a residency program. Lots of them have 4 years of residency. Schooling is more extensive. It's not per se different. We still go to school from my RN to my nurse practitioner was 4 years full time.
Yes.
So we still do, preceptor hours. We still do all of the education, all the classes, the pharmacology classes, and we are still board certified. So we still take a very large exam at the end.
Very large.
We are just considered mid-level. And basically I chose to not, whether it be money, time, residency, things I couldn't avoid. People stop at mid-level instead of choosing to go forward.
Sure.
Mostly, a lot of times too, it's actually, what I have experienced so far in my career. I collaborate with a physician where I'm at, Dr. Huntley. Yes. So if you don't know him or haven't met him, you need to. The most amazing doctor ever. So I collaborate with him. So basically, he's kind of like, my book when I need to throw cases and stuff by him. So you kind of essentially become a team.
Sure.
even though I'm a mid-level provider, and he is a physician, we're a team essentially, and he is my backbone when, I'm not one of those people that it's not admitting defeat, but if something's a little bit higher than where I feel like my knowledge level sits, that's when I can collaborate with him. Yes, absolutely.
Yeah. I don't even like that term mid-level provider because I think that nurse practitioners basically, I see a nurse practitioner, like, as far as your family doctor, this girl is it, and you, I think that's just a kind of a not fair term, but that's just my opinion because you all do basically everything.
We do. I can do anything. I see infants. I can see clear up to, 9800, whatever, I see from infant to geriatric. I can do essentially family practice is full body. So I'm not into especially, so I am into everything,
a little bit
send them.
I don't know how you do that. How do you know a little bit about everything or a lot about everything? Like, how do you do that?
I will say my years in nursing gave me great experience to kind of push forward to know, like my knowledge in nursing.
Yes.
And I had a wonderful hospitalist who my last bedside job kind of took me under his wing and was like, he's from a different country and he'd say, now, Bree, what would you do? And he would he would force me to tell him what I would do with that.
That's so good though.
So he was like a huge, huge, huge helper to me. And we do it all, even people don't realize, but even as family practice, I can still do PAPs and, things like that. So I'm an all-in-one style person.
Yes.
So I kind of have to know a little bit about everything. And, that has been essentially hard at times because you have to know the whole body. Mm-hmm. But it's also awesome, too, to know that as a nurse practitioner in family practice, I can manage everything.
Yeah.
Unless it's beyond something that I can manage, like a break or something they need to see ortho. But for the most part, coughs, colds, urgent care needs, PAPs, just general year physicals, preventative measures, babies, adults, I can kind of see it all. And I think that's really cool. So that's kind of why I chose to go with family medicine, is just so I could do head to toe, any age.
Love that. So. That is just so good. Good for you. And it just fits right into your personality too. Okay. So you mentioned about like the ages of people. So you can see, birth to on up.
I can see anyone.
Yeah.
And I love everyone. So, I love everyone. Coming from a background, I did bedside nursing. That was a lot more of the older population, chronic exacerbations of diseases and things like that. Therapy. So I did a lot of my career in that with older population, geriatrics. Prior to taking a year off from nursing, I was into special needs. So I did special needs for about 4 years. I was a home care case manager. So I really found how to communicate with people that don't know how to communicate very well. Gotcha. They do, but they have their own way.
Yeah.
And if you don't find that way, or you don't take the time to find that way, it can make things a lot harder. So I did special needs pediatrics. Actually, that brought on my absolute love for kids, other than always loving kids. But these babies, you would bring them home and you would have to manage their care, and they would be trachs or G tubes, and so many of them I have on Facebook now that I can and watch them grow because I'm not in, their actual casework, and they've lost trachs finally. They've came off their ventilators. They've, they don't have a G tube anymore, and they're just thriving. They're thriving. So that is like my big goal is I don't care what age you are. I don't care what disability, chronic disease you have. You need to thrive every day. I want you to thrive every day. Yeah. So that has kind of been the best part for me, is just we can thrive being a kid, and we figure out, your best ways to make you thrive, whether you're an infant level, toddler, and I don't care if you're 90 years old. We're still going to thrive. We're going to dance down the hallway.
That's right.
We're going to dance down the hallway. You're going to feel good. So that's kind of been my driving force, to just kind of be able to see all ages.
Love that. Absolutely. Again, so now she has to know about all ages on top of knowing the whole body.
Yeah, it's a lot at times, but good thing there's a lot of resources available for us if we're questioning something. And I will say 100% with Holzer, it doesn't matter what specialty I've called. If I've been like, hey, I'm going to run this case by you. This is my plan. Is that, where you seem like you're going? And wonderful. Wonderful.
And that was like going to be, I guess, my next comment is the fact that I kind of think of family medicine as the concierge, if you will, of like the medical world. And I don't mean that you just farm everybody out. I mean, like you're the first person they go to, and then you assess the situation, and then if there is some kind of strange, specialty thing, then you're arranging for that person to go see the specialist, or talking to the specialist and all that. So that is a whole other aspect of the things that you do.
It is. And that is the best. I feel like that's the best way to appropriately manage care.
Mm-hmm.
Deciding from a family practice position when they come in and they're establishing care, when you say to yourself, is this something I can manage?
Yeah.
Or is this something the specialty needs to manage? There is some things that it's like they have better techniques. They have more options.
Or equipment.
So, then we're able to say, hey, we could do this here. However, if I referred you over here to podiatry, they would have the equipment and tools to manage your best insoles for your feet, or whatever.
Yes.
So yes, and then that also allows us, to be able to communicate. This was the patient. This is how they presented to us. This is where I kind of think they're going, and this is why I'm moving them forward with you. Mm-hmm. So it makes it a good collaboration between specialties and between places that you can send them to. Like I said, thrive.
Well, and I think, like my friend Hannah was here the other day with wound care, and that's specialty stuff. So,
yeah.
That is some, but the cool thing is within the Holzer community, whether it be down in Gallipolis or here in Jackson or at the hospital versus the clinic location or whatever, you all have this network, and there are so many specialists there, obviously family practice as well. But you all can collaborate with each other, and you have all the diagnostic testing and all of that stuff right here. So, the person doesn't have to get thrown out of the system to go get a specialty, treatment.
They do not. There is plenty with Holzer.
Orthopedics, all of that stuff.
Orthopedics, gastro, endocrine, cardiology, pulmonology, OBGYN. There is just so many, and there's so many knowledgeable, great providers in each specialty.
Yeah.
So it's really been, it's been nice to communicate with them. Now, obviously there's less in some departments than others, but I've also found if I really say, hey, this is more of an emergency thing, I don't think, waiting a couple months for a referral, I've never had an issue.
Okay.
ENT, they're getting people in if it's like, hey, so-and-so has this problem going on. It really needs to be addressed kind of quickly, right away. Like, let's find a spot in the schedule. Where can we work this patient in?
Yeah. And that is so important when you have someone, like Breanna being your advocate, because you have to be your own advocate, of course, but you need somebody out there that will fight for you as well. And, you hear all of these stories of, like a woman finds a lump and they call the doctor and it's like, 6 months from now, we might be able to get you in or whatever. Right. That's not acceptable, because if there's something really wrong, like every minute counts.
That's right. Absolutely.
And, so you need someone that will be your advocate. And I think that's wonderful that you guys can do that.
Absolutely. It's really a good organization. With any organization, you're not going to have personalities that fit. Things happen.
Yeah.
I feel like that's with anywhere. As someone who's been involved, whether it be family or myself, with Holzer, Adina, OSU, Children's.
Mm-hmm.
So you're not going to fit with every person, and that's okay. Your personality is not going to fit with everyone.
Yeah.
That doesn't make it a terrible experience.
Right.
That's why when you go to family practice, you have multiple options, because I might not be the right person for you, but for 75 other people, I might be that person.
Yes.
And that's why you have options, and that's why you have lots of providers. And I feel like that's really important. So I do think that Holzer is a wonderful organization. Like I said, I've been there for years and years and years. I was seen there as a baby and seen with Dr. Kim and all of their pediatric practice, and I think they're wonderful. So.
See, there you go. And she works there. So, okay. So why is it important? I heard what you were talking about on the radio as I was driving in, pardon me. And that was, especially people in like their teens up to like 30s, you're invincible, right? And nothing's ever going to happen to you, and you don't need to go to the doctor because that's a waste of time and stupid. So let's talk for a minute about why it is important to always be established with some sort of primary care provider, because, just because you're a teenager and you feel like you're healthy, or 20 something and you feel like you're healthy, doesn't necessarily mean that you are.
Right. So there's many things that kind of play a role in that. And I just say, it's not one of those things where you need to be seen constantly as someone with maybe a chronic management or, something, your chronic disease process. But once a year, number one, keeps my eyes on you. If I would notice something before you would, just small things, if you're coming in and your blood pressure's high, blood pressure plays a mini role in it. Age doesn't really always matter. Your health doesn't really always matter. If dad and grandpa have it, or mom, things like that. Just, using myself as example, 17-year-old girl was put on high blood pressure medicine. Why? Because my dad gave me that lovely trait. My dad, Jim,
thanks, Dad.
Jim, this is bad. This is bad. Had I not been busy and going, and had I not been seeing someone, I probably would have never known that, because a lot of times with something like high blood pressure, you don't feel it till you've had it for a long time, or you don't realize how bad you feel until it's managed.
Correct. Same thing happened with my husband. We had to get insurance, had to have a physical, and the person came to our house and he was like, you have really high blood pressure. And we were like 24 or 5. And he was like, no, I don't. And he tested it like throughout like the 2 hours he was there. He tested it numerous times and it was high every time. So he's like, I think you need to go see your doctor. And he did. And yeah.
So
and he runs every day. And
so you wouldn't think that, because he's running and he's active,
doing all the things that he should be doing, working his butt off. And yeah.
And that helps, because, if you're in your 20s and say you did get high blood pressure and you let it go and you're like 35 finally getting this, like, you could have done major damage inside that you have no clue you've done.
Sure.
Your heart every single day is working harder to do what it should be.
Right.
And especially someone like a runner, he's running every day, so his heart's even working harder, than that.
Yeah.
So I feel like once a year is really important. No, I don't feel like you should have to come all the time, but that once a year not only establishes you, but you're like, hey, I don't feel good. I don't want to go sit in the urgent care for hours. Well, guess what? You're already established with me. So I am going to do everything in my power to fit you in. If I can. Do some kind of telehealth visit, something to where I can get my eyes on you. But not only for that, it's just good. So many things we're finding out are genetic. And so many things, if we are getting our eyes on you once a year, if we're kind of just looking at a baseline set of labs, that can trend. That can trend very quickly. So it is easy. And also, too, women are very prevalent to low iron. So, and when you have low iron, you essentially don't feel good. Vitamin D levels are low. Those are two very minute things that you could take a vitamin for every day to feel good.
It's so simple.
But you might not have known that had you came in and said, hey, I'm just really tired. I don't understand why I'm really tired. Let me look at some things. Okay, well, guess what? You're really iron anemic. So let's get iron on board. Iron's on board 3 months later. I feel better. Well, that's because your iron was super low. So it's kind of just preventative too.
It is, but I think that women in general, and I know that you would admit this, that you're the caregiver for everybody else, and you don't take care of. Women just don't feel like they need to take time for themselves. For some reason, there's a stigma out there that it's not cool or whatever.
That is right.
You need to, Heck, make it a me day. I'm going to the doctor. It's my me day.
I'm going to the
I'm
doctor, and then I'm sneaking to get a pedicure.
Yes.
But the kids are taken care of. So
100%. Like make it something fun, like a me day, and go get your blood work done and see your doctor and do the mammogram and the pap and all that stuff.
I think it's real. I do. I truly think it's important. And one thing I have noticed with my schedule is I'm getting a lot of those 20 to 30-year-olds.
Good.
Which is wonderful. Because not only I feel like they were like, oh, so either word of mouth or seeing me, this girl, I feel comfortable enough to go to her to be seen. And it's great because that management is there. We've established a relationship, and essentially these people can be with me for years and years and years.
Right.
So if I'm seeing someone for years and I notice something's off, I can be like, I've been seeing you for years. This isn't normal. Like something's going on. Yeah. But I do think that we lack, and I think this is everywhere, but preventative. So many preventative things. And I've actually had to be the girl, which they're better now because they have grandbabies, but my parents were terrible. And I'm like, listen, like, you guys got to go. Like, what are you doing? Well, guess you wouldn't believe the grandbabies came and that all changed. We go every year. We do all the things we're supposed to.
They didn't care about you.
They didn't care about me and my sister. But they're like, oh, we got 4 grandbabies now. We better take care of ourselves. But there's so many different preventative things. Mammograms, colonoscopies. If you have a huge family history of breast cancer or colon cancer, like these are things you might not think about you're going to get, but it's very important that someone knows those things.
And it's so easy to prevent that stuff or to
catch it early.
For it. Yes.
Even if you go and it's negative, guess what? It's negative. You
it's
don't have the gene.
Stuff.
A big thing, skins. There's so many free things out there. There's free skin checks and things like that. We are out in the sun, and especially, a lot of the construction men and things, or men who work outside every day. I'm sorry, but y'all men don't listen and put sunscreen on. Nobody listens to us.
Husband just went through that with him. Honey, did you put sunscreen on? We went to a pool. No, I'm good. You know what I did yesterday?
You were rubbing aloe on.
I was all over his back, and now he looks like an alligator. And I'm like, this is disgusting. If you would have just listened to what I was saying,
you would have listened.
And now you've damaged your skin.
I am offended. I am offended by these accusations.
You're a boy.
Because they are so accurate.
I know. Truth hurts, doesn't it, James?
So, that's the big thing. You can get into so many skin places. And the crazy thing is most insurance cover this stuff. They're preventative.
Yes.
They're covering it. So it's just important, not only for preventative measures, but if you find things early, like if you have a huge family history of breast cancer and you go and get the gene tested and you have it. So your percentage is laid out in front of you okay, I've got this percentage chance because mom, grandma, aunts had.
Yes.
You can do steps to help.
Absolutely.
Live a longer life. So I think
proactive, not reactive.
Yeah. So I think that has been really important for me to kind of we got to look at these things.
Yes.
So I do think that's really important, and it doesn't matter to start when you get out of pediatric care and you're moving on to adulthood. It's always good to just establish, even if you check in once a year. Heck, I'd give you every year and a half. Like if you're that person or that 20-year-old that's busy and trying to figure out life, you come see me every year and a half. Let me get my eyes on you.
Yes.
So I think that's super important.
No, and I think it really is. And yeah, I mean, even if you're in college or whatever, and you can just make a visit whenever you happen to be in town.
Yeah.
Cool. Whether that's a few months swing one way or the other, just come in.
Yeah, because then, when things like acute illnesses happen, strep throat, bronchitis, sinus infection, ear infections, you're not sitting at an urgent care having to get into that stuff, or an ER and have to wait.
Exposing
and paying
yourself to
way more
else.
Money, you know, because you're looking at emergent care or urgent care, and you can try to get in with your primary care provider. So I think that's very important.
Yeah, and I love all the things you're saying. It's very, very important. Number one, just to get established. So then you call Breanna and you say, I'm already your patient. Then maybe you can do a telehealth visit because you know what medicines that person's on already, or these things, and they're going, like my throat's sore or whatever. Then you can just
Yeah.
treat it that way
Um,
because you know them already.
Yeah, and that got really big, of course, with when COVID came around.
Sure.
Which I think that it was probably like the best thing I have seen healthcare jump on so quickly, because I don't want my 86-year-old grandma to go, or whatever, to have some sniffles or something going on and have to come out and not know if 10 other people who's been around someone with COVID touch something and then potentially
Correct.
give something terrible. So I do think telehealth was wonderful. And I want to get these people in. And I have talked to a lot of my elderly people that, COVID's still here. The flu is
Very
still,
much. Very much.
things that are really sick, could be an issue for them. And I have you're pretty stable. I'd love to see you in person. Another thing I've taken consideration with telehealth, other than being stable and I know their medicines, I can see them, when you're pushing towards that visit and it's in the middle of winter. Well, a lot of your elderly have trouble getting out.
Sure.
So I've kind of told them let's do a phone call. Let's talk on the phone for a little bit if you can't get in here.
Yeah.
But I want to make sure and touch base with you, listen to your voice, see you, make sure if I've seen that person and I know who they are and they're ill or something, a lot of times a presentation can tell you a lot of things.
Yeah.
Although I love to get my hands on them. I love to listen and things to them, check out ears, nose, whatever. But it's just kind of a good option.
It is.
A good option. And I don't ever mind to use it, especially, like I said, with people that are very immunocompromised or elderly and things like that. You
Yeah,
know?
I mean, coming out in the public may be worse than anything,
Right.
any illness that you have.
Right. And
because-
especially if we can telehealth it and I can safely diagnose it and treat it, and then their daughter or grandkid can pick up the medicine for them.
Yeah.
We've completely avoided that. We've completely avoided
Yes.
that window of hopefully passing any kind of contamination to someone who's already immunocompromised. So yeah, I like it.
So all of that. So there you go. And that's why it's important to establish with a primary care provider.
Yes.
Yeah.
Yes. Very important.
It's very important. All right. So, how do people get a hold of you or get started if they're not already started with you? How do they get established?
So the number is 18554 Holzer.
Mm-hmm.
That is the main line that they can call. And, you just need to say, I want to establish care. If you're establishing in family practice in general, just say, family medicine and what location. If you're specifically looking for someone like me, come see me. You would ask specifically for Breanna Morgan and that you need to establish care. You can do it that way. And then if you are someone like me, tech savvy and can kind of get on, you can go to holzer.org and actually go in to look for a provider in family practice, or you can search my name and
Okay.
you can schedule online.
Oh, that's awesome.
Yes,
Okay.
very nice feature.
Very good. And what location are you?
I am at Holzer Clinic. I'm at 280 Pattonsville Road, and we are upstairs. And I don't travel. That is my base and where I stay location.
Okay, so she's up on top of the place up on the hill.
Yes. Yes.
You're really high up there.
I am. I am up there. I am up there on top of the hill on that second floor, clear up there. So, yes, I am always there. Currently do more of a 4-10 schedule right now. So I'm off on Wednesdays and the weekends. And then when my kiddos and the chaos of preschool starts this year, I go to 5 days. So
Okay, very good. And the great thing about it is, number one, if you haven't been up to the second floor of Holzer or just the first floor of Holzer, it's one of the prettiest views in Jackson. I mean, you can see the whole everything.
you can
from
see
there.
everything.
It's really
from
cool.
there. Yes, it is.
It's really pretty. And also, you can call and get an appointment and see someone right away. And I know that you said that you try to fit people in the best that you possibly can.
Yes, I have communicated that a lot, especially with our receptionist there at the clinic. If I can, I absolutely will. I would much rather see you, and especially if it's something that's cute and needs seen that day, I absolutely will. I've had people message me and say, hey, I totally forgot I have such and such going on. I have to have clearance for, I have to have this. And I'm like, just call. These are my days. These are my days. These are my hours. Typically, most days I can pretty much pull someone in for now, getting established and kind of getting my patient in my caseload. But yes, absolutely. I am one of those that I will typically not say no if I can fit you in.
Yeah.
So I will definitely make room if I can.
Very good. And you know, that means something. I feel like it means something to me when somebody's really, I don't want to say putting yourself out, that's not the right word, but like making yourself available,
Yeah.
and taking that extra step to make sure that people feel like they're cared for, because that's very important.
Yeah, I think
that
it
you
is truly
matter.
important. Absolutely.
It's, you know, I think that's like one of the most frustrating things, and that it's been in the past, is sometimes, you know, you need to be with that primary person that you mesh well with, because you need to feel like you matter and that they care about you. And if you don't feel that way, then you need to find somebody else.
Yeah, you should never. That's what.
Or
That's
they're annoying you.
Yeah, the
or you're-
glorious part of medicine. There's tons of us. So I am huge on that. I am also huge. You know, some providers are very much so on their computer. That's not me. I just can't do it. So I am the type of the girl will do what we need to on the computer, but we're gonna hang out face to face, because I just think
Love
that's so
that.
much better of an experience with them. And then when I was kind of following Dr. Huntley, who, you know, we work together. I loved, he would walk his patients clear to the exit. You don't see that.
That's just such a tiny.
It's the
step
best
that-
gesture.
It is, because
So I took onto that.
well, number one, you get lost in those places.
Yes. So
But
I took
yeah,
onto that, and
good
like
for
his
you.
patients like thrived on that. And I thought, that is a small gesture, but he truly cares and is showing that through walking them to them,
Yeah.
even with the hand on their, you know, the back of the shoulder, just kind of walking. And I just thought, you know, that is the provider I want to be. I want to be someone who, you know, if you need to talk, we're sliding that laptop aside. That stuff can wait. We need to have a face-to-face communication. You need to
Yeah.
cry it out, whatever. We need to talk about
Yeah.
something. You've lost your dog. You've lost your kid's not slept for 13 days, whatever it is.
I get you.
You know, let's have a moment. And
Yeah.
you need someone to talk to. And the good part about it is I don't have an opinion on your life, because I know you to take care of you.
Mhm.
You know, I may know you in the community, but I don't have, you know, we're not
I'm not
best
judging
friends,
you.
you know, going to, so let it all out with me. And it's funny, because my mom will go, are you sure you went to be a nurse practitioner? Because you sound like a therapist. And I'm like, it's fine. I'm a little of both. And it's okay.
Like, and that's okay, because sometimes that's just what somebody needs.
to talk to someone.
Yeah.
And to just kind of have that person that they can be like, okay. And you know, I've really utilized the portal. They're able to directly message, and it comes to me.
Yes.
So I've had a few, you know, younger females really dealing with some things in life, and we've really had to communicate in the office. And I said, you know what, why don't you use that as like a chat? If you've had a bad day, and you don't even need me to necessarily respond, but you need to let it all out to someone that's not mom, dad, cousin,
Correct.
friend, whatever.
Yeah.
I want you to just write it all down. Or even if you just see my name, to send it to me and you write it all down, you feel better, like you've completely vented it out to me.
Yeah.
I want to be that person. So, and I've had a few people utilize it. So it feels
That's
good to know
awesome.
that they feel safe communicating with me.
Yeah, and you should feel safe with your primary
Absolutely.
care physician.
Your visits are between you and I in an office. It's never going outside of there.
Right.
Unless I would need to collaborate with a physician to check on you or take care of you.
And then it never goes outside that circle.
No, never, ever. I am very big on that. I'm a person who, like I said, I'd been seen before for postpartum depression and things like that. And at the time, I felt defeated. I felt like I had prayed for these babies for so long, and then I got them, and then why am I depressed? Like, why would I
not
go into
appreciating
this? Yeah,
it?
like, why don't I love this life I'm living? Like, this isn't normal. So when I got the diagnosis, I was very private about it at first. And then I used it to advocate, because we are normal, but I needed to feel that. And when I went in to talk about it and finally talked to someone, I knew with confidence that it wasn't leaving that room. I knew with confidence that I was going to leave there. And if I wanted to keep it private for the rest of my life, it would be private for the rest of my life. And that's kind of how my door is. When they come in, I don't care what you need to talk about. Unless you done tell me something bad that needs to go somewhere.
Don't tell me about all the illegal things.
Yeah.
You know.
Don't tell
all
me
the
about
meth
all
in your basement. Don't want to hear about it.
Yeah,
but,
yeah. Don't tell me about your side hustles that are illegal or something. Like, let's keep that at bay, but that's my office. That's my space. That's their space. If you need to let it all out, let it all out. So that's kind of how I've used it so far. And so far, it's worked to my advantage. I have enjoyed it. And maybe at the end of some days, I feel like I've done more therapy than being a nurse practitioner, but my heart's full at the end of the day. I've helped someone. So that's kind of how my rooms work.
I love that. I love all about that. Everything. So how do people know in this world, and I've asked a couple of folks that have come in here, but it's changing so much every day. We've seen this little bit of resurgence of the COVID, I hate to say that word even, but how do people know when it's time to actually call and see a doctor and when they should just like take an over the counter or, like, oh, I just have a sniffle. So it's not, they're going to make fun of me for calling or they're going to be mad because I took up time for somebody else. Or how do people know when they should come see you versus just like, well, I can just take care of this myself?
Well, I think a lot of that is different. Well, first off, COVID is the strangest thing. It is. You'll see people and they'll be like, I had vomiting and diarrhea, and they test positive. Or you'll see people and it's like, I sneezed 3 times yesterday.
Yeah.
And I tested positive.
Yes, 100%. And you're like,
so,
and it could be people in the same household that
no,
one has one and one has the other, and you're like,
2 different things.
Yes.
Or my other thing is the households that you got the strong arm that never test positive ever. They've ran through it 2 or 3 times of different types of COVID, and the one person has never, ever got it. And it's like, okay, you live together.
Yeah,
like,
it doesn't make any sense.
So my big philosophy on this is better safe than sorry.
Okay.
And I tried to use that and utilize that. If you're questioning it and you know your body and you're like, okay, I've been to the dollar store this week. I've been to Dollar General. I don't feel good. I kind of feel crummy. A simple lab test will tell us what we need to know to guide you further. The same thing I kind of tell people, if they're messaging and they're like, I've had chest pain. It kind of subsided. But, it was really sharp when it came on. And my philosophy with that's better safe than sorry.
Yeah.
Here's the thing. Regardless of what your insurance pays or don't pay or what that bill is, sometimes the peace of mind of knowing I'm okay is better than something happening.
For sure.
So
then it's really going to cost you, by the way.
Then it's really going to cost you. So I think that is super important. That's how I looked at it. Like, I don't ever think, like if you came to me, and a lot of it too is education. If you came to me and you're sneezing, you're inflamed, you've got some drainage, I see it clearly in your throat, your ears look a little bulged. Mm-hmm. You might not know because your background doesn't know that that's allergies. However, I can get someone started on an allergy medicine and then they feel so much better because they didn't realize it. Yeah. So I don't think there's ever a right or wrong time. I think if you think that there's something going on or something you want to get addressed, or you think, hey, I've been to a lot of community places, putting in a simple order for a COVID test, or just coming to see to make sure that your body's okay or that you have allergies, or any of those things, I think is important.
Yeah. So if something, doesn't feel right, say something about it.
Yes. We don't know if you don't tell us.
Yes.
And that's the best thing.
You're not mind readers. The crystal ball broke a long time ago, right?
And if you don't tell me, like, typically, it's not always a full body thing when you come in family practice. But for just instance, if you have a big lump or spot, I'm not necessarily going to feel underneath your left breast. But if you say to me, hey, I've noticed this, it's grown. I feel like something's going on here. Well, guess what? We're going to lay down and we're going to assess you.
Even if you're there for a sore throat.
Yeah.
Like,
so
you're there.
Let me know. Yeah. Honesty is the best policy. No matter what it is, honesty is the best policy. And you being honest about your body and changes in your body and things that are going on is how I'm going to appropriately treat and be able to measure what we need to do to make you feel better.
Yeah, because nobody knows yourself better than you.
Yeah.
So and maybe your mother, but moms know these things.
That's not true in my case because I know my mom better than she knows me. I'm like, Mom, like this, Mom, like you are not doing this. Or, my new favorite thing they're doing is this is my mom and dad. We're in this group chat with me, my mom, my dad, and my sister. And every single night, sounds silly, but still at 30 years old, I love it. We text each other a 4-way text, love you, good night.
Aww.
I have done it for years. My sister lives on her own with her family. You know, I have my zoo. And then, of course, my parents, they're living their best life. Their girls are out and their grandbabies are taken care of.
And the grandkids are fun.
Yeah. So they'll message me, Breanna, what am I doing Wednesday? I forget. I'm like, are you kidding? I have to keep track of my schedule and not yours. And so the one Wednesday I was like, Mom, you've got to get Gracie. That is my niece, my sister's daughter, and you're getting the kids. And I told you I have to go, wherever after work, and then I'll be there at 5:30. She actually did it yesterday. She said, "Can you tell me your day today? I forget." So I FaceTime her yesterday, and I'm at her pool, and I'm like, Mom, your Ring monitor probably went off and told you where I was at, but you are messaging me asking my plans. So yeah, in that situation, I think that they'll tell you over and over again, my parents, it's a good thing Breanna keeps us in line because I think they would be lost. So I'm managing everyone's schedule around my
and this
zoo.
is why you should have this girl taking care of you too, because she takes care of everybody.
I do. I try really, really hard. So yeah, but it's a good thing. So come on, let me take care of you. I'm just going to take you all. I said my goal is I want to just fill up, I want to just be like that person. That people, I want to be someone that someone hears about. And I said eventually in my life, I would love to just travel the world for a hot minute and talk to people like once or twice a year. Just go and just make everyone feel love, because I just truly think people deserve that life. And
they do.
My life isn't perfect. A lot of times people from the outside look in and think, oh my God, she never has a bad day. I only have 5 a year. I only let myself have 5 bad days a year. That's it.
I need to hang out with you more often.
Come on. So I just feel like everyone deserves that. And sometimes it just takes talking to someone. Sometimes it takes medication management. Sometimes you need something for postpartum depression. But the time I'm done with you, you will be living your best life. I'm fully confident in that because that's really how I work. I work with my heart. And I think if you work with your heart, it trumps your brain every time.
Yeah.
So I'll just be smart and love you. So I think that's very important.
Could you just come hang out here every day?
Yeah, if you supply coffee.
We can do that, can't we, James? Yeah. James would be very happy because he's been my therapist for the past 1.5 or 2 years. So
would you?
He'd be happy to pass the torch.
I will warn you though, Pete Wilson makes the coffee awfully strong.
He does.
Ooh, well then we're kind of in there.
You're in there?
I'm currently in this dilemma of where I need to call the spot on Main because I take a little lunch. Like I don't take a long lunch because the way my schedule works with my kids, God love my manager, Amy, who deals with my shenanigans. The spot on Main needs to get on DoorDash. I've got it. I need that DoorDash to come to clinic.
Well, we can call Jenny and ask her. We can make that happen.
I mean, I cannot help it. I have to have it. So I sneak out, every so often I'll get like a 30, I'll be done with one and the next one's about 35 minutes. And I'm like, so I'm telling my medical assistant, I'm like, listen, I'm running. And homegirl runs and we're getting to the spot on Main and we're getting back on time. Do we have time to prep? And then they really laugh because I have to leave car seats for the babysitter. So I normally have to actually leave my van at home. Well, my husband just lifted up his truck, like, a man thing, put on the tires and all that.
Like so the truck, the lift
put it really
thing.
High. Don't know why. I drive it all the time. He doesn't even drive it. He drives an old work car. So then I have everybody laughing at me because I'm getting out of this lifted truck. Fell out of it the first day in a dress right in front of one of our secretaries because I forgot about it being lifted. Not a good time.
That is awesome.
Not a good time. But I did. I called my husband. I said, listen, I pulled in with our chiropractor the other day. And he's like, man, you knew how to park that truck. And I was like, I got to go. Now I drive a lifted truck.
So
Jack of all trades. Come on.
This girl can take care of you. She drives a cool truck. I mean, who doesn't love her?
But I love my minivan. I can go a lot faster in the minivan than I can the truck.
I could see that.
But we make it to work on time, so we're good.
Yeah. As long as we make it to work on time, we got coffee. Kids are where they're supposed to be. We're
good. We are good. We are good.
Awesome. Awesome. All right. So one more time, if somebody wants to get established with Miss Breanna here, how do they do that? And when are you available and where?
I am at 280 Pattonsville Road, Holzer Clinic. I am upstairs in family practice. You can call 1-855-4-HOLZER, and that will be the phone number to schedule. You can also get on holzer.org. You can look in the family practice department, or you can actually, there's a way to search my name, which is Breanna Morgan. You can then put your appointment in online, so it's at your convenience. It's super user-friendly. I actually had to make appointment with another provider through it, and it was very easy. So
Okay.
I thought, well, this was pretty easy and user friendly. So you can do that. I am off every weekend. Right now, I'm currently off on Wednesdays, but I work Monday, Tuesday, Thursday, Friday, and then come the end of August, I go to Monday through Friday.
Okay. Very good. So she'll be even more available.
I will, kind of, yeah. In a way, we had to kind of, like I said, God love my manager who works with my chaos. We started preschool.
Hey,
and
when you have 3 kids, you got to work around all of this stuff.
So preschool and a husband who leaves really early and gets home really late, and my parents are not retired. And so it's kind of like mom's got to get him from point A to point B. So we worked all that out, though, and I think everything will work out perfect. So
Good. Of course it will.
I hope so.
Yes.
I do. So that was another goal I had with working with my community. I wanted to be able to have one late night a week. The people who work banking hours or places that are 8 to 4, 9 to 5, like I wanted to be that option. Like they could still be established with a provider because they weren't working during all their hours. So I work a
not
late
have
night.
to take time off work.
Yeah. So I work one late night, and then I work 2 early mornings where I start seeing patients at 7 a.m.
Okay.
So, and it seems to work really well. Those 7 a.m. slots seem to be picking up pretty good for the people like that work at banks and things and want to come before their 8 o'clock hour. And my late evening always stays, it's always pretty busy and booked. So
Makes sense.
it seemed to work. Like my thought process and logic for the community seemed to work. So
good for you. See, she got it going on. All right. Well, Miss Breanna Morgan, of course, nurse practitioner in family medicine and primary care at our good friends at Holzer. So thank you. Before we get out of here, what's your favorite part about working at Holzer?
my favorite part.
Oh, gosh, I think I stumped her for a minute because she's having trouble coming up more.
No. So probably the family aspect. I will say that. So make a long story short, I started with Holzer. Throughout starting with Holzer, my 3 kids at different times with different diagnoses were all sick with a really high fever. For 3 solid weeks of the start of my career, I lost power for 5 days during it, and no one hesitated. I had my schedule getting frozen so I could meet babysitters that had my babies to get them checked out downstairs. At one point, I had a kid who had to get a shot, and he was not happy, and so we shoved 2 chairs together in my office and laid him with an iPad to get through the rest of my day to stop my schedule to get me home. I had people offering freezers and hot showers for me and my kids. So I feel like that says a lot. You don't meet many employers that put family first. Yeah. And with Holzer, without a doubt, my manager, my collaborating physician, it has never mattered. I went to him and said, hey, this is what's going on. And they immediately, no hesitation, let's get it figured out for you. What can we do to help you? And that was important to me. If I'm going to be somewhere in a career move for the next 40 plus years or what, however long, that was important to me. And it showed that it was okay, because they could have easily been like, okay, this girl just started. She's now having a power issue.
She's really annoying us.
She's kind of too much.
Yeah.
Her kids are always sick, which is weird because my kids are never sick. And then it was like, bam, bam, bam. We had everything in my house: GI, upper respiratory, double ear infection, positive strep throat. My husband ended up with positive strep throat right behind him. I was like, oh my gosh, that's not happening. But it didn't. They didn't miss a beat. So I felt like the family aspect, which is something I thrive on, was there.
Yeah.
So that was important to me. So that's probably my favorite part.
Awesome. I love that. That's a great story. So, all right. Well, thank you so much. I think we're about out of time, and it's been so fun chatting with you today. Let this girl take care of you because she really wants to, and she does an amazing job, and she cares, and that's
Yes.
important.
Yes. Thank you for having me.
Of course, it's our pleasure. All right. Well, have a wonderful day, everyone, and we will be back here tomorrow on Friday. Are we going to do news tomorrow? What are we doing, James?
We have the Jackson County Fair Queens tomorrow, and we're going to do the drawing for our Red Roof Inn.
Yes.
Giveaway.
So yeah. So we have, and that is on the Total Media.
Yeah, on the Total Media Facebook page, find the post with that little Red Roof flyer.
This
and,
one.
Yeah, and enter to win a free one-night stay at a Red Roof Inn, round of golf, and $10 off at Stockroom 601.
There you go. Yeah, and all you have to do is go on the Total Media Facebook page, like and share that post with that on it, and you'll be registered. And the Fair Queens will draw tomorrow. Somebody's going to win anywhere you want to go at the Red Roof Inn. All right. Cool. All right. Well, have a wonderful day, everyone. Thanks for spending your morning with us. Get
Have a
back
good
to work so you can take care of people. And we will be right back here tomorrow with a lot more fun. So thanks for watching, everyone. Bye-bye.